All right. Hello, everyone. Here we go. Thank you for watching this webinar on the 8-minute rule. There's no audio taping or videotaping allowed in any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information in this presentation is for educational purposes. It's not intended to be legal advice. I'm not a lawyer. Target coding does not provide legal services. I've made every attempt to make certain the information in this presentation is 100% accurate. However, it's not guaranteed. I'll tell you a little bit about myself for those of you that do not know who I am. My name is Dr. Marty Kotler. I am a chiropractor. I am the president of Target Coding. I'm also a certified professional compliance officer and a certified billing and coding specialist. That's what those additional initials are after my name, after the DC. And I consider myself kind of unique because most chiropractors are not certified coders. Most certified compliance officers are not chiropractors. So I take this unique approach. I can challenge my clients when they come up with certain clinical situations that doesn't make sense, and then I could show them how to bill and code properly. Some people consider me the insurance guy. I don't consider myself the insurance guy. I consider myself the compliance guy. I just want to make sure you're billing and coding properly. You're maximizing reimbursement. You're doing all the things that you're supposed to do within your scope of practice, within your state laws, within your boundaries. Not only do I teach billing and coding seminars, but I teach risk management, medical errors, and ethics. So I want to make sure you're doing everything properly, and I want to make sure you're not leaving any money on the table and maximizing reimbursement. I've written many books and training manuals on chiropractic billing and coding and documentation. I write articles to the major publications and newspapers that you see coming across your desk, like Chiropractic Economics, Dynamic Chiropractic, The American Chiropractor. I also write articles for the American Academy of Professional Coders. I write articles for many state association newsletters and journals. I do webinars for many other state associations, and I'm a guest speaker at many state association conventions nationwide. By the way, those of you that are part of your state association that's looking for a speaker, maybe you want to have us come by and do a session for your group at your conventions. I could usually get a sponsor, so there's no money out of pocket to the state associations. Our calendar is pretty full for the next year, but if you are interested, let us know. Maybe we could work something out. So as far as the timed codes, the 8-minute rule, right? That's the topic today, the 8-minute rule. Let's get started now. Who could provide these timed codes and untimed codes, right? Let's start off with who can touch the patient, who's allowed to do these services. Well, here we go. We have two sets of people that can do services in a practice setting. You have QHPs, and many have clinical staff. So QHPs, that stands for Qualified Healthcare Professionals. Qualified healthcare professionals is defined as a person, a healthcare provider that's been trained, is licensed, and could report services to an insurance company. That's on the left side, like chiros and MDs and nurse practitioners and PTs and occupational therapists and massage therapists, and then clinical staff. Clinical staff are terrific, wonderful people. They're trained. They're not licensed. Sometimes they are, sometimes they aren't. But the key thing is with clinical staff is they cannot report services directly to insurance companies. So you're talking about CAs and PTAs and nurses and athletic trainers and exercise physiologists and rehab techs. These are wonderful people that are trained, and they could assist and help out in many states. But if they were in the office all alone without a QHP, they would not be able to provide the service. They would not be able to bill an insurance company. Now, nurse practitioners are very, very in demand lately in the doctors that I work with that are integrated. Probably 75 to 80% of the doctors that I work with are chiro only, and about 25 to 30% are integrated. The docs that are integrated that want to bring on medical services, not only PT, bring on nurse practitioners. Very popular, very common in chiropractic settings, so I thought I'd just mention this. Nurse practitioners can initiate care plans, and they can recommend services and procedures. Nurse practitioners are allowed to administer and supervise mechanical traction, ultrasound, therapeutic exercises. They are allowed. to do those services and bill for them. There are approximately 325 colleges and universities that teach nurse practitioner programs. There are approximately 270,000 nurse practitioners in the country, about 200,000 PTs, about 65,000 PTAs, about 90,000 chiropractors, and there are over 1 million medical doctors. Now, the state laws and rules, they could be complex. Sometimes they're hard to find. I'm working with a doctor right now. He doesn't even know he has his staff doing the therapies. He found out recently because an insurance company pointed it out, and this doctor's been in practice for 10 years. He recently found out he's not allowed to have his CAs do the therapies from an insurance company. Are they going to want money back? We'll see. This just happened. So it could be confusing. It could be hard to find. This doctor contacted his own state board and they couldn't get a straight answer. How to go to the health department and keep digging. So it could be complex. Sometimes it's hard to find. The rules vary from state to state. You know, there are some states in the country that do not allow CAs to do anything, not even put a hot pack on a patient. So you want to check with your state board to make sure who can supply services in your practice. Does it have to be a QHP? Could it be a clinical staff member? You also want to check with the health plans on the supervision requirements. Who needs to be on site when the services are performed? Most of the time, direct supervision is fine, but you also have personal and general, so make sure you know the supervision levels. All right, now let's dig in. Time codes versus untimed codes. That's how we're going to get to the 8-minute rule. So time codes and untimed codes. Let's start with the untimed codes, modalities, supervised modalities. These are not time-based. This is the application of a modality that does not require one-on-one contact. It's not time-based. Application of a modality, one or more areas. So we have the top 3 are the most common: hot and cold packs, mechanical traction, electrical stim, unattended electrical stim. So I've given you some photos, so just in case you're not sure what those types of modalities are. Vasopneumatic, paraffin, whirlpool, diathermy, or infrared, ultraviolet, they're not that common. I don't see those being used. I guess out of the bottom few there, I would say maybe diathermy, no, infrared 97026. Some doctors have that coming out of the laser. So application of a modality does not require one-on-one contact. It's not time-based. So let me pick one. I don't know. Mechanical traction. You set the patient up on traction. You, or if you're, the doctor, or if your state allows CAs to do it. So the patient is set up on mechanical traction. Doctor could walk out of the room. Staff can walk out of the room. You could even close the door, leave the patient all alone in the room. You could leave the patient in there for 10 minutes, 15 minutes, 5 minutes, 8 minutes, 20 minutes. It's not time-based. You could only bill one unit. You see, it says one or more areas. So we're looking at hot and cold, which doesn't get paid that often, right? Those of you that have been around for a while. Now, we have students on the line that are learning this for the first time. I know that for a fact. And we have doctors that have been in practice for over 30 years listening to this. So just trying to cover all bases. Hot and cold packs, for those of you that are new to this world of chiropractic billing and coding, hot and cold packs very rarely get paid. Maybe your PIs will pay, your personal injury carriers like State Farm, Geico, Allstate. It's very rare that a regular insurance company will pay, especially if you're in network. And forget about, United Healthcare. They're not going to pay for hot and cold packs. I could tell you that right up front. And then mechanical traction, terrific. Unattended stim. Those are the top 3 supervised modalities. And let us know if you have any questions on that. And now we switch to constant attendance modalities. Constant attendance modalities. Well, things change drastically here because of one thing. I'll read first the definition. The application of a modality that does require one-on-one patient contact. Application of a modality, one or more areas, each 15 minutes. So, requires one-on-one each 15 minutes. Those are the 2 big things that change from the supervised modalities. Now, if you look at this list, The one that's the most common is ultrasound, 97035. There's a picture, patient getting ultrasound. So that's attended. It has to be one-on-one. Can't give the patient the ultrasound head and walk away, right? That's not one-on-one. Now, there are some manufacturers, at least one, that sells an unattended ultrasound device where the ultrasound device gets Velcroed or attached to the patient, and then the provider walks away. I don't recommend billing 97035 for that service. Now, there's other things that are done, like you might see the vibration platform there. How do you bill for that? And the dry hydrotherapy, how do you bill for that? We're going to get into that in a few minutes. So now, if you do ultrasound for 15 minutes on, let's say, the upper back, and then you want to do ultrasound for another 15 minutes on a knee or a shoulder, you can bill these in units. The supervised modalities like the stim, the unattended stim, and the hot and cold and the mechanical traction, can't build those in units. These codes you could build in units. You could build, if you want to build ultrasound for 2 units or 3 units, you can. You can't build 3 units of mechanical traction. It's not a timed code. Now the other code, I guess the second most common on this list would be 97032, which is attended or manual electrical stim. So that can come through the ultrasound head, or you stay in the room with the patient while they're getting electrical stim. Those are the 2 most common. All right, let's move on. Those are, any questions, let us know. Now we're going to move to therapeutic procedures. Now things drastically change. One of the main things that change here is that you don't need a piece of equipment necessarily for this. You see, with modalities, whether it was supervised or constant attendance, you needed a device, a table, a machine, a gizmo, whatever you want to call it, right? If you're going to bill for ultrasound, you need an ultrasound machine. If you're going to bill for electrical stim, you need an electrical stim machine. If you're going to bill for mechanical traction, you need a mechanical traction machine, device, table. But when it comes to therapeutic procedures, you don't need any equipment. So what is it based on? See, with modalities, it's based on the piece of equipment that you buy. If you buy an ultrasound machine, you bill 97035. When it comes to therapeutic procedures, it's not based on equipment. So how do you pick a code? It's based on your intended outcome. What are you trying to accomplish? So let's read the definition. Therapeutic procedures, a manner of effecting change through the application of clinical skills and/or services that attempt to improve function. Provider required to have one-on-one contact, one or more areas each 15 minutes. So there you go. Need one-on-one contact. You could bill it in units because it says each 15 minutes. If you remember a couple of minutes ago, I'll go back. When you look at the supervised modalities, it doesn't say each 15 minutes. So that's another clue that these are not timed codes. So back to therapeutic procedures. It says each 15 minutes, so you can build these in units. We're going to get to the units in a minute. But a couple other things in the definition that you should be aware of. You see it says application of clinical skills. Many of you are billing 97110 and 112 and 140. So if you get questions, so Dr. Kotler, what skills are you applying when the patient is having these services done? Or I see, Dr. Kotler, your staff, your CAs, your certified CAs, or your licensed chiropractic assistants are overseeing patients doing exercises and neuromuscular reeducation and therapy. What clinical skills are you or your staff members applying? That's a question you should know how to answer. And are those services attempting to improve function? Is there a gradual improvement? So those are the definitions that, those are the key things you should be, focusing on. So let's go therapeutic exercise. Let's go for the first one. That's an active procedure. So you're applying clinical skills by you're there, you're telling the patient what to do, go a little faster, go a little slower, hands-on. See, if you have a patient just doing an exercise and you or your staff, are reading your emails on your phone and you're just kind of glancing over to the patient, what clinical skills are you applying? Same thing with neuromuscular reeducation. That's to improve balance and coordination. So therapeutic exercises is used to improve strength, endurance, range of motion, flexibility. I like to use a acronym with 110, SERF, S-E-R-F. S stands for strength, E endurance, R range of motion, F flexibility. You have to show that the patient has a lack of one of those things, right? If you're billing 97110 and the patient has full strength, full range of motion, full flexibility, why would you bill that code? Now, if you want to use it on a patient in that scenario to pay cash, it's fine, but not billing insurance. Same thing with NMR. That's to improve balance and coordination and kinesthetic sense. So if you're billing that code, what should the patient have a lack of? Yeah, balance, coordination, kinesthetic sense. Then we have manual therapy, terrific code used by a lot of chiropractors and staff members. Manual therapy, it consists of one or more of the following: myofascial release, manual lymphatic drainage, soft tissue mobilization, joint mobilization. These are all manual therapy services. Manual lymphatic drainage, manual traction. Can't be done in the same anatomic site as the adjustment. That's where that CCI edit with the 59 modifier comes in. And that's passive. That's passive. You see at the bottom of the screen, those are passive. Patient is on the side, getting soft tissue, deep soft tissue. Patient is lying there doing nothing. Then we have therapeutic activities. Now, if you look at the picture all the way in the bottom right corner, there's a patient lifting a ball. So therapeutic activities, that involves improving bending, lifting, reaching, carrying, throwing. It's an activity code where the patient has to be actually performing or reenacting something they're doing during the day, an activity of daily living. A lot of people call it the ING code because whatever you have the patient doing, it has to be going towards improving the patient's ability for bending, reaching, lifting, carrying, throwing. You know, let's say here comes Jennifer. She's 27 years old. She just had a baby. She has a 7-month-old baby. And she says, when I go down into the crib to lift my baby out of the crib or lift my baby off the floor, Dr. Kotler, that's when my back goes into spasm. That's where I feel the most pain. So I'm going to have Jessica go through certain reenacting of bending and lifting her child out of the crib. So that's therapeutic activities. And then we have some unlisted codes like 97039. I mentioned vibration platform, dry hydrotherapy. Probably going to use that code. An unlisted therapeutic procedure. Maybe you're doing something that's there's no specific code for. That's 97139 for a therapeutic procedure, or 97799, an unlisted physical medicine rehab procedure. Sometimes you need to build that for spinal decompression. So unlisted codes need to have a procedure report in the file just in case the patient asks, the insurance company asks for it. Now, a lot of doctors ask, how do you bill for laser? Well, the CPT code, there is no CPT code for laser at the present time. We are getting one soon. We're also getting a code for cupping. Those of you that, dry needling, not cupping. Dry needling, we will be having a CPT code coming up soon, and for laser. But right now, if the patient says, bill my insurance for the laser, you could use 97039 or S8948. That's a HCPCS code for low-level laser therapy. Now, sometimes you're in the room. This could happen. It's rare, but let's say, we're talking about the 52 modifier right now for reduced service because some doctors they're doing timed codes for like 1 or 2 minutes, and they're just putting the 52 modifier on it and billing their full normal fee, getting paid. I'm a little concerned about that. I've seen a few issues, not a lot, but I've seen a few issues with that. But understand the purpose of 52. 52 should be used sparingly. It's a situation where you weren't able to finish the service. That's why it's called a reduced service. So the example I have there, 97035 ultrasound. So let's say you're doing ultrasound and this patient always gets 8 minutes of ultrasound. But on this particular day, after like a minute or two, the patient says, Dr. Kotler, stop. I have to go. I forgot. I got to go pick up my kids at school. And you stop doing the ultrasound after 2 minutes. Medicare and many other health plans say anything under 8 minutes you should not bill at all. However, if you want to bill just to be transparent and try and get paid, then you would bill 97035 with the 52 modifier, and I would lower your fee too, just to be transparent. It means you didn't complete the service. So if you're billing this on an every visit, the insurance company could think, why isn't this doctor ever completing the service? It's a reduced service. So if he's reducing, if something's reduced, you're reducing it from something. So what was the something that was it being reduced from? What is that code? How do you bill that? Do you ever do that? Do you have a different fee for that? See how coding can get tricky. Now, here we go. According to Medicare and many plans, the units are based on total time. So 8 to 22 minutes is 1 unit, 23 to 37 minutes is 2 units, and on and on. So here's where it gets tricky. You ready? You do 97140 for 23 minutes. Oh, yeah, I could bill 2 units, right? Okay. And then you follow that with 97110 for another 23 minutes. Your thinking could be, oh, I could bill 2 units of each for a total of 4 units. Time out. Hold on. Pump the brakes. Total that up. What is that? 46 minutes? 46 minutes is only 3 units. Look to the right. You see 140, 30 minutes, 110, 23 minutes. What's the total? 53. Aha, now you could bill 4 units, 2 of each. Now it's very, very rare, but I do know a couple of insurance companies, they provided it to me in writing because I couldn't believe it, that do use what I call the rule of 8. There's total time, which is what you should be following for most of your plans, and there are a few plans out there that will use the rule of 8, which is, it's right on your screen, 97140, 8 minutes. 97110, another 8 minutes. There are a few plans that will allow you to bill for both, even though the total was 16. It's rare. Don't do it unless you have something in writing from a health plan that allows it. Because if you billed like United Healthcare for 16 minutes of 2 codes, you'd only be able to get paid for 1, because you got to get to that 23rd minute. 16 minutes falls in between 8 and 22. You'd only be able to bill 1 unit. You'd have to pick 1 code. Which one would you pick to bill? The one that pays more, right? All right, you ready for a little surprise quiz? Here we go. 10 minutes of myofascial, 10 minutes of exercise, and then 5 minutes of mechanical traction, and then you adjust C5, C6. Can you bill both myofascial and exercises? No. You'd have to pick 140 or 110 because the total time is 20 minutes, and traction 97012, and then here's your chiropractic manipulation code. Next, 15 minutes of mechanical traction, and you adjust C1, T2, and L5. Traction and 98941. Next, 7 minutes of unattended stim, and you adjust C5, L4, and the left knee. There's your 97014. It could also be billed as G02A3 depending upon the plan. There's your spinal adjustment, your extremity adjustment. Next, re-exam. 15 minutes of traction on the neck, 15 minutes of mechanical traction on the lumbar region, and you adjust C1 and L5. There's your re-exam. Traction, 1 time. I'm working with a doc, well, not anymore because the audit is over, but I was working with a doctor where he was billing 2 units of mechanical traction. His consultant told him this is what he had: a cervical traction unit, very good unit, I've seen it, and then he had a lumbar traction device, also a very good unit. Patients that came in with neck pain and low back pain, he would do cervical traction, and then he'd take the patient off that table and bring it over to the lumbar traction table and do that. And he was billing 2 units of mechanical traction, 97012, getting paid. Now he comes on board as a client of Target Coding, and I'm reviewing his EOBs, and I went, I don't like this. I said, Doc, I don't want you to bill 97012 for 2 units anymore. He said, what? My consultant told me it's okay. I use 2 traction units, and the insurance company's paying me. It must be okay. I said, Doc, please don't bill this anymore. I don't like it. It doesn't seem right. He reluctantly stopped. A few months later, he gets a request for records. it shows that he's doing traction in 2 areas. The insurance company wants money back, but fortunately, most of the visits that they wanted money back for um, were in the past. Moving forward, he wasn't doing it anymore. If he continued to do it, he would have had to pay an extra $3,000 to $5,000. 97012, regardless of how many body parts you do it on and how long, it's 1 unit, and there's your adjustment code. Next, 15 minutes of myofascial, 10 minutes of exercise, and you adjust C2, T10 in the left SI joint. Can you build both timed codes? Yes, because you got to 25 minutes. Next, 15 minutes of massage, 10 minutes of ultrasound, and 13 minutes of NMR. And you adjust L4 and L5. How would you build this? Can you build for all of those timed codes? Total it up. What is it total? Are all timed? Massage? Yeah. Ultrasound? Yeah. Okay, what is the total? 38 minutes? Yeah, you could bill all three. 3 units is 38 to 52 minutes. I'm 38 right there, exactly 38. And there's your adjustment. 10 minutes of massage, 10 minutes of exercise, and 10 minutes of activities. Total of 30 minutes. And you adjust T10 and L3. How would you bill this? Total is 30 minutes, but you did 3 separate timed codes. All right, appropriate billing is 30 minutes, so it's 2 units. You're going to select 2 codes to bill since each service was performed for the same time. Only 2 units are allowed. And we have re-exam, 10 minutes of ADL, that's 97535, 15 minutes of massage, and you adjust C1 and L3. There's your re-exam, your ADL, your massage, and your adjustment. So there's a little quiz I thought everybody would like. All right, just a few closing comments. I want to close, before we get to questions and answers, I want to close by giving you my 9-step action plan. Step 1, you want to be proactive. When it comes to billing and coding, get proactive. What does that mean? Don't wait for the oil light to flash on your dashboard. Get out of the car and check the oil. Have policies, have procedures, have trainings with your staff, document your trainings, go to seminars, learn how to bill and code properly. Step 2, this is for staff. Make sure that the patient completes all the new patient forms. Before they're allowed to go meet the doctor, make sure the patient completely fills out all the forms. We review forms for many of our gold members here at Target Coding, and patients are not filling out the forms, and it can turn into an issue. Simple one. I'll give you an example right now. The doctor prescribed a TENS machine to a patient. TENS requires chronic condition. The patient's intake form says, how long have you had this condition? Left it blank. And there was nothing in there that talked about how long the patient had the problem. Now the doctor has to give the money back because the information was insufficient. So, and there's other things. The patient comes in, they don't put their social security number down or their credit card information. They come in for a couple of visits and they disappear, and now you don't have any information to go after them. Make sure they fill out all the forms. Step 3 is for the doctors. Doctors, review all the paperwork prior to going in and seeing the patient. Step 4, review the policies from the insurance companies you bill the most. That's what we do with our compliance plans. When we offer a doctor a billing and coding compliance plan, we give the doctor the billing policies from the insurance companies that the doctor bills. So if you're billing Blue Cross Blue Shield, we'll give you the policy for it. Aetna, Cigna, United Healthcare will give you the policy on chiropractic so you know exactly what they're looking for. Step 5, understand the what. What are you doing, what you're doing, and why you're doing it. Your CPT codes are what you're doing, your diagnosis codes are why you're doing them, and they're supposed to pair, and they're supposed to match. You've heard of food combining or food pairing, like wine, like what wine do you drink with meat, and what, do you drink white wine with fish, right? Food, wine, pairing. I do code pairing. So what are you doing? Let's say you're doing mechanical traction. That's 97012. Why are you doing it? There you go. Patient may have cervical radiculopathy, M5412, or disc degeneration. What are you doing? You're doing manual therapy, specifically myofascial release 97140. That pairs beautifully with M7912, cervical myalgia, or M5126, lumbar disc displacement. You see, you're pairing your CPD codes and your diagnosis codes. That's what you should be doing. That's what we teach here at Target Coding. Now, you may have heard of a sommelier. That's a wine master. They know how to pair your food and wine. I'm a coding sommelier. I will pair your CPD codes and your diagnosis codes. We have a book that has all of these in them. Here's another one. What are you doing? You're doing therapeutic exercises, but why are you doing it? Oh, the patient has neck pain, M54-2, or shoulder stiffness, M25611. That's on the right side. Here's an easy one, right? What are you doing? Chiropractic adjustments or manipulation. Why? Why do you do I mean, that's a funny question if you're ever asked. So, Dr. Kotler, why do you do chiropractic adjustments? The answer should be simple: to correct subluxations. Diagnosis M9901 in the neck. Of adjusting the knee, it's M9906. Next, do a self-test on your SOAP notes. Make sure you know what a medically necessary SOAP note looks like. Step 7, attend seminars and webinars on a regular basis. By the way, those of you listening to this webinar, if you would like a sample SOAP note so you could see what a medically necessary, I'm step 6, I'm saying find out what a medically necessary SOAP note looks like. You might be saying, I don't know what one looks like, and I don't have any friends to ask. So contact us. Email amy@targetcoding.com. That's AMY@targetcoding.com, and say, hey, could I get a sample medically necessary SOAP note? We'll send it to you. Step 7, always keep learning. You should always keep learning how to help more patients, improve your business, right? Step 8, you should have a simple billing and coding policy manual, if nothing else, to protect you from your staff becoming whistleblowers. You may have heard about whistleblowers in the news a lot lately. Your staff, if not happy, can quit on you and be a disgruntled staff member and now be a whistleblower and report you to insurance companies. How do you protect yourself from something like that? With a billing manual that everybody knows that you bill properly and everybody signs off on it. Put together a simple policy manual. Step 8, do regular staff meetings with your staff, especially to the insurance companies that pay you the most. If you have a billing company, check with your billing company. By the way, Target Coding now does billing. Yes, we do billing now. You want to do all this so you could SWAN. That's my favorite acronym, SWAN, SWAN. What does that mean? Sleep well at night. So just a few closing comments. You got to check with all the carriers prior to billing to make sure it's compliant. Do your best. There's changes that occur all the time. So do your best to stay on top of these changes by attending seminars, webinars, and join your national and state professional associations. Thank everybody for attending. Here's my contact information. Before we get to questions and answers, you have a question for me? You want to set up a free consultation? There's my email, drkotler@targetcoding.com. Website, targetcoding.com. Telephone number, 800-270-7044. If you want to fax me a sample something with a patient information on it, like we have some clients, they'll fax me an EOB. Dr. Kotler, why aren't I getting paid? Fax that to our HIPAA secure fax number. You shouldn't be emailing or faxing things without protecting patient information. We also have a HIPAA secure email portal. If you need to email stuff to us, you don't have to white out or black out patient names. It gets encrypted when you send it to us. Contact us for a free consultation. We offer free consultation. Just have general questions. You have questions about how we can help you. You have questions about your staff. You want a quick, for 15 minutes, you want to be trained on something. You get me for 15 minutes. Take advantage of it. Set up a free consultation. Email me or info@targetcoding.com. Set up a free consultation just to chat and see how things are going. Now, before we get to questions and answers, let me tell you, at Target Coding, we do more than just these webinars. We sell products, we sell videos and books, we offer services, we do on-site training, one-on-one consulting, we offer compliance programs, Medicare billing and coding compliance programs, and HIPAA compliance programs. We have memberships. We do seminars all over the country. Compliance is a big thing. You're going to see in the next few months, every chiropractic journal, newspaper, magazine you get, there's going to be something written on chiropractic compliance. It might not be me, it might be another consultant, but you're going to see a lot about compliance. And to me, chiropractic compliance consists of three things: HIPAA, OIG, and OSHA. OIG equals billing and coding. So HIPAA, billing and coding, and OSHA. So I have a question. Do you get HIPAA headaches? Do you have OIG procrastination, OSHA indigestion? Outsource your compliance program to us. We do all the heavy lifting. It's $199 a month. That's stretched out over 12 months. It does not take 12 months to go through the program. If you want to prepay for the program, you can, and we could be done installing your compliance plan in probably 3 months, but most doctors like to stretch it out over a year. So we have $199 a month. We do all the heavy lifting. We do the security risk analysis with you. We have multiple meetings. We show you how to access our cloud-based system where your staff can watch HIPAA videos, and then they take a little test, and then they print out a certificate, and it's actually a nice training, and you'll feel much better after it's done. It's like exercise. Most of you, I can tell you, I do not like exercising. When I wake up in the morning and I'm like, oh boy, I got to go to the gym, I am not interested. I am not excited about it. But after I'm done, I am so happy. The happiness overtakes the rejection that I had earlier. Same thing with HIPAA and compliance. It's not fun to do, but after it's over, you're going to feel great. How about ASH? Anybody having problems with ASH? You want to get more visits out of ASH, or you want to get more cash out of your ASH patients? We cover both. We have live training. You pick the day, you pick the time, and we'll do a live training for you and your entire office. Put everybody into one room, everybody crowd around one computer. It costs $249, and we will show you how to deal with ASH properly, how to get more visits, how to get more cash. We'll show you sample forms, sample financial forms, billing forms, medical necessity review forms. I mentioned earlier the code pairing. How to pair your codes. It's from this book. It's a book on the best chiropractic ICD-10 and CPT codes to improve reimbursement. It has a lot of things in it. It shows you the long-term treatment codes. You'd probably like to know the long-term treatment codes. Why? Because they pay for more visits than short-term treatment codes. So that's in the book. In the book, we give you some clinical stuff, like if you're going to diagnose a patient with cervical radiculopathy, what ortho, neuro, and chiro tests should you have in your exam to substantiate it? We have about, I think about 25 of the most common ICD-10 codes and how to substantiate them. That's where my clinical, being in practice for 16 years, is being combined with my 12 years of coding expertise. I combine the clinical, and then I show you how to bill and code for it. That's in the book. Also, how to pair your codes. I mentioned that earlier. I'm the coding sommelier. Also, there are, these cheat sheets that show you the codes that pay for the most visits. What else do we do with target coding? Oh, we have a CA boot camp. These are 4 modules. We cover everything. I don't know. You think of something that a CA can do, I think we have it covered. Module 1, front desk and patient relations. Module 2, billing and collections. Module 3, therapy and back office. We have clients that their CAs are in the back doing the therapies and doing the notes. That's Module 3. Module 4 is teaching your staff, your office manager, how to be respected and how to be able to supervise a large staff and import proper compliance. So we have a CA bootcamp, 4 modules. Each module is 2 parts, where it's a total of 8 classes. I mentioned earlier, we do billing. Outsource your billing to us. Maybe you don't want to do your billing anymore. Maybe you're tired of hiring and firing and hiring and firing. If you can't keep CAs or billing managers, you need to outsource your billing. Call us. Let us know. Maybe we can help you. We also sell forms. I don't care if you have ChiroTouch, Eclipse, ACOM, doesn't matter to me what software you have, you still need forms. Like what? Letters of medical necessity, financial forms, completed ABN forms. We give you a whole bunch of sample SOAP notes, exam forms, health history forms, HIPAA forms. We have physical therapy forms in there, acupuncture forms, your Medicare sample SOAP notes, and again, all your HIPAA forms. So we do hear a lot here at Target Coding. Some doctors say, Dr. Kyle, I just want you to take a look at my notes and tell me how I'm doing. I'm not being audited. I'm not being investigated, but I want to be proactive. I want you to take a look at my notes and tell me how I'm doing. We could do that. We'll do a checkup on your notes. We call it our comprehensive chart audit and fee schedule review. You send us 5 charts. We'll help find money you're leaving on the table. How do I know that? For most of you, not all of you, we'll find money you're leaving on the table. You've seen those farmers insurance commercials. We know a thing or two because we've seen a thing or two. Same here. 12 years of doing this. There are many doctors. We've added one CPT code and it's equaled an additional $10,000 to the practice. So it's another thing that we could do. We could do a chart audit review. Now, oh, look at this. Our second annual Target Coding Cruise seminar is coming up. How would you like to come on a vacation cruise, vacation of a lifetime, and also be able to go to a seminar and use the seminar as a tax deduction, right? That's a nice combination. So we have our second annual cruise coming up in April, 10 CE credits. Those of you that are acupuncturists or you have acupuncture in your office, this seminar has been approved for 6 PDA points. That's what it's called in acupuncture, PDA points. It's been approved for 6 PDA points for chiropractic. And certified CAs, it's approved for 10 credits. Last year, we had a fantastic cruise. We had over 50 cabins filled with doctors, and I brought my family. So we're very excited about the second annual Target Coding Cruise Seminar coming up. We're actually planning our third annual. That has not been released yet, but that's in the works already because you got to plan these way in advance. And then we have videos. You just want to buy a video. We have 11 videos that we sell. HIPAA compliance manuals, very important, seminars. So again, I want to thank everybody for attending. Here's my contact information. Let's go to questions and answers right now.